Make a sudden high-pitched noise or ask if they want to go for a walk, and most dogs will instantly do this. We tend to project human emotions onto this reaction. We assume they are confused, trying to ask us a question, or simply putting on an act to look cute. But dogs do not manipulate their posture purely for aesthetics. That sudden twist of the neck is actually the execution of a highly complex biological and sensory calculation. It operates as a sophisticated translation protocol, a physical action bridging the gap between canine anatomy and the human environment. To understand why they do it, we have to look at their anatomy. First, there is the hurdle of directional hearing. Dogs have ear flaps that often partially or completely cover their ear canals, which creates a physical barrier to incoming sound waves. This animated diagram shows how tilting the head solves the problem. It exposes the ear canal, allowing the dog to calculate the exact distance of high-frequency sounds based on microsecond time delays. To make these auditory micro-adjustments, dogs rely on 18 auricular muscles to shift and lock their ear flops into the optimal listening position. Then there is the second biological hurdle, visual clearance. A dog's prominent muzzle is a massive physical barrier sitting directly in the middle of its face. Look at this diagram from a dog's perspective. The physical mass of their snout creates a distinct blind spot, completely blocking the lower half of their visual field. By tilting the head 45 degrees, they shift that obstruction out of the way. This specific angle allows the dog to clearly read human facial expressions and mouth movements that were previously hidden by their own nose. Ultimately, the tilt is a mechanical workaround. Dogs are physically shifting their bodies and bone structure just to see and hear us clearly. Beyond physics, there is a cognitive processing element. Clinical researchers recently tested gifted word learner dogs to see how they process familiar vocabulary. This bar chart highlights the massive discrepancy they found. Word learning dogs tilted their heads 43% of the time when processing familiar words, compared to only 2% in typical dogs. In this context, the tilt is a physical manifestation of memory recall. The brain is actively searching for a word association. This reveals an evolutionary irony. Over thousands of years, humans selectively bred dogs for baby-like traits, like the floppy ears and elongated snouts you see on this collie. We actively bred these sensory barriers into their anatomy. We genetically engineered their flaws, and now we cross-species reinforce the behavior, rewarding them with treats and affection when they use the tilt to overcome the exact barriers we gave them. But what does it mean if a dog tilts its head when the room is perfectly silent and there are absolutely no auditory or visual triggers present? There is a crucial difference to look for. A behavioral head tilt is situational and temporary. A medical head tilt is constant and rigid. This anatomical cross-section illustrates the inner ear, the site of a condition called vestibular disease. This is a catastrophic breakdown of the balance center located in the inner ear and the brain. When this system fails, the rigid head tilt is accompanied by severe physical warning signs. Owners will notice their dog stumbling, walking in continuous circles, and exhibiting involuntary eye jerking. These severe symptoms require immediate veterinary intervention. An unprompted, persistent tilt, especially in older dogs, can point to brain tumors, strokes, or severe inner ear infections. The head tilt is always a translation protocol. Most of the time, it is your dog actively trying to translate and understand its human environment. But if the tilt won't stop, it is your dog's failing nervous system communicating a medical emergency directly to you.